Hi everyone, we're back, and today our topic for discussion is your critical thinking. Regardless of where you work, your critical thinking is extremely important. Otherwise, you're going to get very flustered when things go wrong. Here are some helpful pointers. First, you gather information regarding the history of your patient, diagnosis, treatment, and try to familiarize yourself with the plan of care. In one of our videos, the plan of care and nursing diagnosis is discussed. Then, if you are the nurse in charge, of course, sometimes it happens more prematurely than you would imagine, you try to delegate responsibilities to the staff members who are under your charge. You also should familiarize yourself with your unit's policies and procedures. Like when families come along, they have questions, it's very important that you know what to respond to. You assess patients and their needs, like social services example. And let's take the case of this new nurse who's called, I believe his name is John. He said, I have no idea what to do, so I'm just going to stand here. He's working in the emergency room. There is a code going on, and he's just going to stand and look around. Not good enough. Some nurses may never have worked in an ICU and ER, but there's always a beginning. You can take a look at the clinical setting step by step, chapters 7 and 14, and they'll give you some insight in how to organize yourself in these areas. Here are some helpful suggestions. For Tim or John, I've forgotten which one, what he could have done was get an EKG strip, check the IV bags to make sure if they're getting empty. Often in emergency room, you flush fluids in very quickly, especially in a trauma patient. Make sure there's some extra ones if they're needed. Make sure if there's anybody to be called, you can make a phone call and do little things. Make sure there are trash cans around so things are not winding up on the floor, and just many little things. If you take the trouble, you'll be of help to some. Just ask people, what can I do to help you? Here is a new nurse. Patients in isolation for MRSA of the wound. She has no idea how to organize herself. If you have a patient in isolation, you don't want to have to, because you have to wear gowns, gloves, and masks every time you strip it off. Go back to get one item, strip it off again. As soon as you put it on, time to go back. You need to try to organize your thinking. First of all, you should make sure there is an isolation cot outside that patient's room. And here are some helpful hints. When assigned to such a patient, you make sure that the gowns and gloves and everything are well stocked on that cot. Then you make sure you have things like thermometers, medications, IV fluids, and whatever else you need. Gather it all together, put it in a place very close, and then put it inside the room so that when you gown and glove it, make sure you've got linen bags for bins for your linen, trash cans, so when you get into the room, everything's ready to go. You never leave medications outside. When I say gather medications, gather them up, put them in the room, take them in with you when you're going in there. There is, of course, some very helpful information at Your Critical Thinking, and if you just click on the link, it'll take you straight there. Hope you've enjoyed learning. Have a nice day.